we should give importance to this Pratishyaya. And because it is not only causing nasal problems, but also eye problems, headache, deafness, etc. Because long-standing rhinitis will give rise to deafness and also eye pain. And as you see now, there will be kasa, shwasa, etc. And also, not only that, it will also give rise to minor problems like hair fall, graying, etc. So we have to give importance to this Chikitsa of Pratishyaya. So whenever we treat any disease, we should never forget that Samprapti Vighatanam hi Chikitsa. That is the idea. So that is why we have to we have to give first line of treatment, that is avoidance of the Nidana Parivarchana. That is as Sanksheptaha Kriya Yogo Nidhanam Parivarchanam. That is our main theme whenever we are treating. So we have to identify the causative factors and we have to treat. Unless and until we avoid the causative factors, then we cannot be free from the disease. So that's why avoiding allergens and other precipitating factors are very important. So you have to identify the different allergens to which we are exposed, especially in case of allergic rhinitis, and we have to be away from it. So that is why we have to avoid these causative factors. We have to identify and also you have to avoid them. That is the first line of treatment. And whenever we are giving the treatment, we should give Sarvadaihika Chikitsa, then Vyadhi Shamatvahara Chikitsa, and also Sthanika Chikitsa, because that is very important. So when we look into the management of Pratishyaya, we have this Yukti Vyaprashraya Chikitsa. So in that we have to go for Langhana, especially for 5 diseases, Akshi, Kukshi, then Pratishyaya, Vrana, and Jwara, we have to go for Pancharatrena Langhanam. So this is the basic criteria. And because we see that 90% of the stimulation of the taste is through the olfactory route, and whenever we have cold, etc., we will have loss of appetite. So that is and in such cases, if we go on eating excess food, etc., that will give rise to indigestion, ama formation, etc. So that is why Langhana is advised at that as a primary chikitsa. So you can go for Langhana chikitsa. Along with that Langhana, you can also give Deepana Pachana Kashayas. So that is also very helpful in ama Pachana. And also we can go for this Shodhana chikitsa if it is long-standing chronic disease, or we can, if it is an acute disease, you can go for Shamana Chikitsa. And in some chronic diseases, you can also plan for Brahmana Chikitsa, Santarpana Chikitsa. And in case of some this Apatarpana Chikitsa also, if there is excess kapha vitiation, you can go for Apatarpana Chikitsa, ama formation, etc. So in that way, you have to plan the treatment based on Dosha Upapana Chikitsa or Srotra Vaigunyakara Chikitsa, because here Srota Varodha will be there, and Vyadhi Shamatvahara Chikitsa. So this should be the line of treatment whenever you are managing the Pratishyaya. And also you have to see whether the disease is in ama stage or is in pakva stage. That is very important, because the treatment protocol totally differs in ama Pratishyaya. So it may start with Langhana at least for 3 to 5 days, then followed by Svedana, then Deepana Pachana Kashaya, then intake of Amla Ushna Tikshna Dravyas, because here you have to go for this Amapachana Chikitsa. And also at this stage you have to use some Ushna, this hot water in the form, the gargles or Ushna Jala intake also should be advised. Then Dhumanasya can be, Snehana Nasya is usually avoided in this thing, so that you should keep in mind. So you can go for Dhumanasya. And also in Pakva stage, here you have to go for more of Santarpana Chikitsa and Brahmana Chikitsa. Whereas in Ama Pratishyaya, you have to go for Apatarpana Chikitsa, because already the ama is formed and they will be, you have to digest the ama. So that's why you have to take more of this Apatarpana Chikitsa. In Pakva Pratishyaya, there will be the Vyadhi Shamatvara Chikitsa, then Rasayana Chikitsa, and also you have to give this Santarpana and Brahmana Chikitsa, because already the immunity will be compromised. In order to enhance the immunity, you have to follow all these measures. So that is why Ghrutapana is advised in this stage in Pakva Pratishyaya, whereas it is not advised in Ama Pratishyaya. And also you can also apply some of the treatment protocols which are used in Nava Pratishyaya, like the use of Amla Dravyas, like Svedana, etc. Then you can go for Panchakarma Chikitsa at this stage, because it is a chronic problem. So Shodhana is very important. And also local therapists will play a very important role here in the form of Shirovirechana, Nasya, Gandush, Kavala, Gandusha, etc. And also Tikshna Dhumapana, in order to bring out, do the shodhana of the doshas which are already accumulated in the nasal cavities, because once, unless and until you remove this vitiated doshas, the disease will not subside. So you can, for therapies, you can go for fermentation with amla dravyas, which are kapha and vata, nashaka, and also srota shodhaka. And also Nadi Sweda is very important for liquefaction of kapha and removing the stagnated secretions, and also it reduces the mucosal edema. And you can also use this Potli Sweda in the form of Ruksha or Snigdha Potli. And you can also use this Upanaha and Pani Sweda, that will be very beneficial, and it will be soothing, especially it reduces the pain in frontal sinus or in the temporal or the occipital area. And also if there is Shavathu, Shrava, Nasa Varodha, etc., then you can go for Shankara Sweda. And Dhumapana also is very important therapy, because it is used, prepared from medicines like this Gugulu, Bacha, Shigru, etc. And these are volatile substances which will help in penetrating into the nose as well as the sinuses, and also brings out the doshas from those areas, which is very important, because unless and until the ostium of the sinuses is blocked, we cannot remove the secretions from the sinus. So this helps in removing the blocked ostium. And also Deepana Pachana Kashaya internally will take care of the Agni levels, and also it will, most of these dravyas will help in Pratishyaya. Like we can go for Panchakola Fanta, or you can use Shunti Maricha Guda, or Dashamula Kwath, or Gojivadi Kwath, etc. So this will also be help in boosting up the immunity. And when in chronic diseases, we can go for Ghrutapano, depending upon the type of dosha which is vitiated. And you can go for Dashamula Ghruta, or you can, and sometimes if it is purely Vata in origin, like in case of Vasomotor rhinitis, you can use Brahmi Ghruta or Ashwagandha Ghruta, etc. Depending upon the case, you have to select the particular Ghruta. So if it is Pittaja related, then you have to use this Ishtimadhu Ghruta. And or you can use Shatavari Ghruta. And also lukewarm Mamsarasa is advisable, especially in Jirna Pratishyaya, because that will help in boosting up the immunity, because Mamsa is very important for increasing the immunity. So that's why we have to take Mamsarasa as well as lukewarm milk, especially milk with this jaggery, or with this Ardraka or Shunti. It will be very beneficial. It will also reduce the ama, and also it will be Bhrumana in nature. Then in some cases, you have to also plan for this Astapana Basti, if it is chronic diseases, chronic rhinitis, allergic rhinitis, etc. And also you can go for this Nasya and Dhumapana Chikitsa. So diet also is very important. Whenever you are treating a Pratishyaya patient, you have to use any dravya which is guru. It will also cause adverse effects. So that's why you have to use Laghu Ahara, and which is because especially you are going to liquefy the kapha and also remove the Vata Prakopa. And also ginger is specially recommended. Ginger with, especially boiled with milk. And this Ikshu also is very important. Ikshu rasa, because it is Ushnavirya that can be taken. And food Annapana also, especially in Jina Pratishyaya, it should be Snigdha, Laghu, and Ruksha also. Sometimes in this thing, Ama stage also, we can recommend this food step. And also milk is also Madhura Rasa, and it is Vrishya and Balya, so that can be taken. So nowadays, turmeric with milk, it is anti-allergic and it is most recommended. So whenever we are treating oral Shamana Chikitsa, you have to either use some medicated powders or decoctions or tablets, and also at the end, you have to also use the Rasayana. So in that way, you can use various formulations. So whenever you are treating Pratishyaya, you should never forget that you have to use a combination of medicines. So only along with powders, you can add some Kwatha preparations like Gojibhadi Kwatha or Dashamula Kwatha you can add. And also Sutopalati is one of the drug of choice in Pratishyaya. And this Sutopalati can be combined with Godanti and Pittanta, because that is also having Gairika, which is anti-allergic. And also you can use this Doshadivanti. Mahalakshmi Vilas is one of the drug of choice in any type of rhinitis. And then Sanjeevani Vati, Mrutyunjaya Rasa. Sometimes you can also use, if there is infective condition, you can use Trifala Gugulu, Gandhak Rasayan, etc. when it is mucopurulent discharge, or Nimbadi Gugulu can also be used. And if it is associated with any ear discharge, then you can add Sarivadi Vati also. So Rasayanas which are especially recommended in Pratishyaya are Vyagri Haritaki, Avastya Haritaki, or Haritra Khanda. And also you, in order to boost up the immunity, you can use this Apraka Bhasma and Yashada Bhasma. So this is very important. So you can also, if there is Kasa, Shwasa, etc., you can use Apraka Bhasma, Godanti Bhasma, Pushkara Mula Churna, Shungyadi Churna. This is, and also if there is allergic condition, you can use this Lakhu Sutta Mishrana, then Haridra Khanda, etc. So you have to mix and match many of the medicines. So Yoshadivati, if there is more of congestion in the throat, etc., you can use Yoshadivati, Lavangati Vati, that also controls the secretion and it will control the throat pain, etc. And Mrutyunjay Rasa is also very important, because these Rasa Aushadhis help in recovery, in quick recovery, and it will act like an antibiotic. Mahalakshmi Viras Rasa or Mrutyunjay Rasa, it is very helpful. And as I have told, Rasayanas also should be used, must and should, in all chronic rhinitis. So this you can also understand the importance of rasayana. Here you can use this Naimantikara type of rasayana, or Vyadihar rasayana, which will give resistance from the disease. So here we can also understand that this rasayana, on the basis of the, because it increases the production of this interferon gamma, etc. This is very important for inhibiting the IgE production and B lymphocytes, because these are important for causing allergic reactions. So that's why we have to give this rasayanas. And also we can understand the function of these rasayanas, because they help in inhibition of T helper lymphocytes. And also these are very important for producing these allergic reactions, because they produce cytokines and promote allergic responses. So that's why these T helper sites, T2 lymphocytes, will be inhibited because through this rasayana therapy. And also this rasayana therapy also indirectly, it will help in boosting up the immunity, because it will regulate this T regulatory helper cells, and also it will inhibit the Th2 responses, which will give rise to this formation of cytokines, etc. And also one more study has shown that there will be reduction in eosinophil migration to nasal mucosa, as well as reduction in inflammatory mediator response because of this rasayana. And usually in modern science, we see that immunotherapy is advised in symptoms which are not controlled, especially in allergic rhinitis. If it is not controlled, then they go for immunotherapy. So we can definitely use this rasayana therapy instead of immunotherapy, and because this immunotherapy decreases IgE levels and increases IgG levels, which are very important, and which block antibodies causing allergic reactions. Next important procedure, which is very helpful, and it is a topical procedure in all types of Pratishyaya, is Nasya. So depending upon the type of involvement of the doshas, you have to go for this Pradhamna Nasya, especially in case of kapha involvement. If it is there will excess of stagnated secretions, etc., then you have to go for Pradhamna Nasya. We can use here Katphala, or we can use Trikattu Churna, which are very simple and easily available. Just blow 3 snuffs of this powder, very fine powder, into the nose. In children, we can also wrap this powders in a small handkerchief, and that can be inhaled. Then Navana Nasya is recommended in chronic cases, especially in case of Vataja diseases. And if it is involved, if the patient, where we need to give Shirovirechana drug, and the patient is very, this thing, very Balaka, or his pregnant lady, or Sukumara, in such cases, we can use this Kalingadi Taila, Shigru Taila, etc., because they are very Tikshna Shirovirechana Dravyas. And most in case of allergic rhinitis, etc., we can use this Shadbindu Taila or Anu Taila, etc. And in case of Kaphaja disorders, we can use Tikshna, where we need Tikshna Shirovirechana type of Nasya. You can use this Shigru Taila or Hingvadi Taila. And Pathadi Taila, especially, it is very good drug in case of chronic rhinitis, that is Pinasa, as well as in case of allergic rhinitis. It is a very important drug. And in case of sinusitis, etc., you can go for this Avapidana Nasya in the form of Guda Nagara Nasya. It is very effective in any type of sinusitis. And we can also use this Vacha Pipali Nasya, or we can use Trikattu Nasya. So whenever we are making avapidana nasya, it is better to use fresh drug. In cases where fresh drug is not available, then you have to soak either vacha or pipali in little lukewarm water to make a paste, and then you have to squeeze out the content. So in a little, it is tikshna form of nasya. So, but it will be very helpful in opening the ostium of the sinuses. So that's why this nasya is one of the best nasal drug delivery for all urdhva jatrugat vikaras. And not only the any this, I have told you the different types of nasya which can be used, but all based nasya especially recommended in vataja disorders. And also it is seen that this lipid layer, if it is instilled in the nasal cavity, then it will control antigen antibody reactions, and thereby it is very helpful in allergic controlling the symptoms of allergic rhinitis. And here, whenever we are doing nasya, we are also giving steam, local fermentation, etc. And we are also doing massage, which will help in capillary, improving the capillary permeability and a better absorption of the drug to the site of pathogenesis. So in that way, and I say it is very important because directly it will tackle at the stage of the entry of allergen. So that is why even in coronavirus, the corona pandemic, the steam is helpful, as well as nasya drug. When we instill it into the nose, we can prevent the entry of any allergen or virus, etc. And also it is one of the best shodhana procedure for udhra jatugatas vikaras. Here we can use this shirovirechana dravyas like katrikatu, vacha, hingu, etc. Or if we can use it in the form of oil based nasya with these same drugs. And head low position also helps in pulling the drug to the in the sinuses, etc. And also it will help in retention of the drug for a little more extent, and help in this bioavailability of the drug which is instilled into the nose. And also there will be lipid soluble substances have greater chance for passive absorption through the cell membrane. So this was also a study. So in that way, the drug absorption is enhanced whenever we are doing massage, which is done in the form of purva karma, and also local fermentation, which will help in improving the drug delivery. And also we have one more procedure called as nasa pichu. So this nasa pichu is instilling the medicated drug and keeping it into the in nasal passages. So it is very effective in conditions like nasa pratinaha, that is in case of deviated nasal septum. So whenever they have specially recommended this bala taila. So bala taila is help having ephedrine, and it will help in opening the ostium of the sinuses, and also it will help by whenever we keep a pichu, that will also help in the form of dilatation of the nasal passages, and also it will relieve the symptom of nasal obstruction. So along with nasya, we can also go for nasa pichu. And especially in case of turbinate hypertrophy, in case of polyps, we can use some chitrakadi taila, tikshna nasya, kapamarga shara taila, etc. When we are not able to remove the polyp, and if it is deep seated, etc. So here this is also very important procedure, especially in case of deviated nasal septum. And also this steam inhalation is very important therapy, as because it removes the trapped secretion from the sinuses, and also it reduces the nasal edema and congestion. And also most of the viruses, bacteria, etc., they will be killed because of the steam, because the temperature will be more, and it will, because this steam also contains some volatile contents which will also enter not only into the nose sinuses but also into the lungs, and thereby relieve the condition. So in that way, this dhumapana is a very important therapy, especially for kapha and vata disorders. And here, when in dhumapana, we use this plant-based volatile components which are in microionized form, and this will help in not only removing the doshas, but also it promotes strength and prevents diseases of the urdhva jatru. And also it removes secretions, and thereby these secretions, when they are retained inside, they will create an unhealthy atmosphere in the nose, and thereby give rise to infections. So that also reduces. And also because of this this edema and nasal blockage, etc., will be reduced, thereby the patency or shodhakana effect also will be achieved with this dhumapana. And we can usually use the dhumapana, we can prepare in the form of varti, or you can just use the smear it over the cloth. You can prepare the paste and you can use it in the form of varti, or you can just make a hard paste and you can dry it in the sun and you use it in the form of a cigar. So that also can be used. So in that way, whenever we are treating diseases, we should never forget that Patya is also, as well as Apatya, are very important, especially from Ayurveda point of view. So whenever you are advising the Pratishyaya patient, you have to ask the patient to eat these substances like ahara. You can use Godhuma Yava, Purana Shali, Masura Kulatha Mudka, and avoid this Dadhi, Shira, etc. You can use Dadima, Lashuna, and Jangala Mamsa. So Dadhi can be used, usually is recommended in chronic form. So if a patient has to use Dadhi, then he has to mix it with Maricha and Guda, and then he can use it. And then in case of Vihara, he should use hot water, then gargles, drink warm water, wear warm clothes, advise this recurrent Dhumapana, Gandusha, etc. should be advised. In Apatya, he should not eat Guru Madhura Ahara, which will give rise to Ama, this formation, and also Shita Jala, etc., which will again give rise to constriction of the blood vessels, because Shita constricts blood vessels, and thereby it will help in precipitation of the viruses. So that's why Pratishyaya Rogi should avoid this food stuff, because that is one cause. Whenever a Pratishyaya Rogi follows this Apatya, Ahara, and Vihara, that is the cause for giving rise to chronicity of the problem. So rhinitis, acute rhinitis may get converted into chronic rhinitis because of chronic exposure to the etiopathogenesis, like same causative factors, either he's taking internally or he is exposed to the same causative factors, then it will give rise to chronic problems. So then Vihara also, you can avoid this Jalakrida, Maithuna, that is because that will give rise to reduction in immunity. Ojakshaya, Shukrakshaya, causes Ojakshaya. Ojakshaya in turn will reduce the immunity of the patient. And Adi Chintana, etc., that is also one cause for this stress, etc., is one cause for decreasing the immunity. So that's why we have to avoid this Krodha, Shoka, and other Manasika Vegas. And also usually Pratishyaya Rogi should wear Guru this thing clothes, means very warm clothes he should wear, and avoid this Bhumishaya, sleeping on the floor. That itself will give rise to Pratishyaya. So in that way you can avoid, and you can also go for some procedures like nasal douching, etc. Jalaneti, it can easily be practiced. So instead of using lukewarm water with salt, you can use Tankana Jala, or you can use this Dashamula Kwath, etc. So this Masha Baladi Kwatha especially is recommended in chronic problems, especially if there is chronic rhinitis, or if there is chronic Swara Bheda, etc. So you can use this Jalaneti nasal douching, especially with medicated decoctions, because it will maintain hygiene of the nasal cavity, and it is also considered to be chakshusha in nature. So that's why, in order to improve your eyesight also, you can go for nasal douching, because especially in case of atrophic rhinitis and other chronic diseases, where there is crusting, etc. So healthy atmosphere in the nose can be maintained by nasal douching, because it removes all the unwanted secretions from the nose and maintains a clean, hygienic atmosphere, and thereby it avoids the invasion by bacteria or viruses, etc. So in that way, nowadays yoga is very important. Especially you have to practice pranayama, kapalabhati. Especially in case of the sinusitis, you can go for ushtrasana and bhastrika pranayama. So all these pranayamas are very important, because they will help in not only getting good proper air to the nose, as well as to the lungs, which are very important. And in this corona times, we have to practice this all these yoga asanas in order to build our immunity, and also so that our pulmonary circulation also improves, and the air reaches into our lungs. So this is the summary of the Pratishyaya Chikitsa. So starting with Deepana Pachana, with Panchakola, then you can go for this Amapachana Chikitsa, then Rasayana Chikitsa, then local therapies like Nasya, Dhumapana, Gandusha, etc. And also Patya. Patya is very important, and internally also you can give all these medicines. So I hope all of you have understood this topic, and if there are any doubts, you can question me.
Thank you, madam. Thank you very much. Thank you. It's a very wonderful session, madam. and thank you very much for enlightening our student. If they ask examination, if they ask nasal examination or Pratishyaya Chikitsa, definitely our student will remember you, madam. Thank you very much, ma'am. Dr. Santosh, sir, please continue.
Okay, sir. Thank you, sir. Thank you, madam. Thank you so much for sharing this very wonderful knowledge. Madam, there is a question asked by Dr. N.Y. Pattar, sir. Preparation of Guda Nagara Nasya, madam.
Okay, it's very simple. Just you have to take this Guda and this little pinch of Guda and one pinch of Nagara. So you have to first make a paste of this Nagara or ginger, and then you have to squeeze out the rasa. And to that squeezed rasa, just add a pinch of Guda and just make it this thing like a solution. And then you can sometimes you can filter it, or if it has mixed properly, then there is no need to filter. And if the patient is little sukumara or very delicate, then you may have to dilute it with little 4 or 5 drops of milk, because some patients they will not tolerate it. So you can dilute it with 5-6 drops of milk. So
okay, madam. Thank you, madam.
It's very easy and it's
one
very
more
effective.
question, madam. Yes, madam.
Yeah. Sure.
One more question asked by Dr. M.D. Kasim. Differential diagnosis between Pratishyaya and COVID-19.
COVID-19, yeah. Actually, Pratishyaya in COVID-19 symptoms, it will start in Pratishyaya. So we cannot say like COVID-19, it falls in Pratishyaya itself, because Pratishyaya, it will include all those diseases wherein there is discharge from the nose. So COVID-19 also comes in a type of Pratishyaya, we can say, because it starts with pranavas only. From the nose it starts. So initially the patient's prognosis will be very quick. In Pratishyaya, patient may have initially there will be nasal blockage, nasal obstruction, nasal discharge, etc. But these symptoms can be overcome. Whereas in COVID-19, the virus it will initially involve the nasal cavity and it will spread to the throat. From there, it invades into the lungs. So the lung parenchyma will be, the parenchymatous tissue, the alveolar tissue, especially in the lungs, that will be damaged. So alveolar damage will rise to all the other symptoms. So there will be hypoxia, etc. So the symptoms are very severe. COVID-19 symptoms are very severe and very acute. And if it is controlled, then it definitely give rise to, it will be fatal, because it will damage the lungs. So that's why we have to prevent damage. So how we prevent the damage is, one is by repeat steam inhalation, will kill the virus. Also by application of this oil based, or you can use this bindu or anula, you can use as pratimarsha whenever you go out. So that will prevent the if any virus also enters the nose, we have this protective mucus blanket which will destroy any type of virus. Because if your immune system is strong, then we have this interferon and the IgG antibodies, etc., which will kill that virus, and that killed virus will come to the throat, and either we spit it out or it will go to the stomach. So definitely we have our own defense. If it comes to the throat, you can go for repeated gargles. And this dhumapana, it will also not only reach the throat, the nose and sinuses, but also deep inside the bronchi, and thereby it will help in killing the virus, because this virus will not survive. So 37 degrees Fahrenheit, I think this centigrade, this virus will killed 37 centigrade. So that's why we have to use steam. Will have more temperature be more in the steam. So that's why it help in killing the virus. So that's so. So COVID-19, it is a pandemic. So this has already explained, because it's under a Sankramika Roga, which will at the Pranavaha strokes. So definitely, because its symptoms are linked to Pratishyaya. Initial symptoms, it will have Pratishyaya, but not. Because see, you see, there is a famous quotation from Madhavanana, Pratishyaya samjayate kasaha, kasaha samjayata shwasa, shwasa samjayate shayah. So that's Pratishyaya if negated, so when we don't take care of the virus at the level of the nose as well as throat or even the bronchi, then it will enter into the lungs. That will give rise to cough. So when it is entering into throat, that is throat, that is pharynx, or it comes to the oropharynx, or if it comes to the bronchi, we will have cough. It will help remove the virus through the protective reflex cough. So once it has gone deep, then it will involve the bronchi, giving shwasa, symptoms of dyspnea. So there will be alveolar distension, etc. So that's why it will best to the symptoms here. So in that way, already it is told in our 6 that it is a step-by-step procedure. Pratishyaya, Kasa, Shwasa, Shaya. So it is happening in the same way in corona.
Okay, madam. Thank you, madam. Another question asked by our UG student. In Vataja Pratishyaya, which oral medicine is best, madam? He is asking about oral medicine.
So if you are taking Vataja oral medicine, so you can use this Shirabala 101 capsule. You can use Shirabala capsule. You can use Mrinjaya Rasa, or you can use Mahalakshmi Lasa Rasa. So Pratishyaya also, it is a very broad term. So you have to see that it is acute stage. It is acute rhinitis. So that symptoms will be, the treatment will be based on Ama Pratishyaya, as I do. But if it is in chronic form, then it's based on Jira Pratishyaya. So in Jira Pratishyaya, you have to use this Balataila Nasal. You have to use Balataila internally also, or you can use Shirabala, not one capsule. You can use Ashwagandha, Dashamula, Dashamula, Ghrita, Dashamula Katutrai. That will be very helpful. Because not only Vata, also Kapha also will involve to some extent. So that's why Kapha Hara Chikitsa done.
Okay, madam. Thank you, madam. Madam, another question asked by our PG student. In case of a pediatric or in a Balaroga, can be done Nasa Pichu, madam?
Yeah, sure, we can do it. So while do Nasa Pichu, you use a gauze. You can dip in lukewarm melted oil, and you have to remove the oil to an extent, and then you have to stuff nasal cavity, and you have to keep a small amount outside so that you easily pull it. So usually children, very small children, not allow above 10 years. You can definitely do this, because when I have done at the age of 8 years also. But some parents also need to monitor, because children, even if we introduce, they will, at least should be kept for 1 hour. But children, they usually try to remove it. And some children, they also have the habit of pushing deeper inside. So that also should be taken care of. Whenever they are applying, it should be under our supervision.
Okay. One more question, madam. Last question. In for Nasya, which oil is more used in clinical practice, madam?
So we have to first know that it's a acute stage. So in acute stage, I don't prefer oil-based. Nasya is itself contraindicated. It is in chronic stage, you have to again see the dosha vitiation. So if it is kapha is more involved, there's thick discharge, etc., then you can use this Shigru Taila or Hingvadi Taila, or you can use very strong Taila. So sometimes Anu Taila also will help. But if it is more of kapha type, then you use very oil, like I told, Hingwadi, Guru, etc. But if it is in case inflammatory type, etc., then you have to use this Eshtimadu Taila in case of Pittaja diseases. And if it is in Vataja diseases, you can use Bala Taila, you can use Anu Taila, you can the Bindu can also be used in Pittaja, kind of Pittaja, and Vataja it can be used, because it is more of Madhura Rasa. So in rhinitis, etc., Bindu will be helpful. Even Anu Taila can also be used. So depending upon the patient, depending on the chronicity, etc., and depending on the dosha, you select the oil. Then only you get results. Lathadi Taila, it is recommended for all chronic diseases, chronic venous. So even if it is Pratishyaya, then you have use very strong, like if it is sinusitis, etc., you use very strong oil. So it be in the form of Hingwa Taila, Shigruta, etc. So in a way you have to vary. So it's not the same for all. Depending upon patient condition, dosha, chronicity, etc., you have to set the oil.
Okay, madam.
So you cannot,
Thank you so much.
cannot label that this soil is particularly, it can be in that disease. So you have to see the condition and then decide.
Okay, madam. Okay. Thank you so much, madam. Thanks to Dr. Madam for being with us and sharing a wonderful knowledge with us, madam. Thank you so much on behalf of our college principal, sir, Dr. K.C. Das, sir, and our on behalf of our HOD, Dr. Vinod Jadhav, sir, and SS More, sir, and also on behalf of Dr. Prema, madam, and on behalf of our ILCAL practitioners and also UG and PG students. Thank you so much, madam. Be continue with us, madam. Thank you so much, madam. Thank you so much.
Thank you.
Thank you. Thank you, Dr. Santosh. Thank you.
Thank you, sir. Thank you so much. Budni sir? Budni sir is there? Chandrakant Budni sir?
Yes, sir. End ಮಾಡಲಿ sir.
Yes, sir. Thank you, sir. Once again, thank you so much.
Welcome, sir. Most welcome. Sorry, sir. Session end ಮಾಡಿ sir. Hello.
End ಮಾಡ್ಬಿಡಿ.
ಸರಿ ಸರ್.
End ಮಾಡಿ sir, ಮುಗಿತು.